The CDC recently named loneliness a public health priority that can be as bad for health as smoking 15 cigarettes a day. Tonight is part of our monthly AARP-sponsored segment that highlights issues important to older adults in Arizona. We look at the risks of loneliness and isolation. And joining us now is Dr. Amit Shah. He's a geriatrician from Mayo Clinic, Arizona. Welcome, Dr. Shah. Good to have you here.
Thanks for having me.
Loneliness and isolation in older adults linked to all sorts of serious stuff here. Is this surprising to you?
Not to me as a geriatrician, of course. I see this all the time and talk to my patients often about the health impacts of loneliness and social isolation. But it's surprising to a lot of people. They don't think of being lonely or being isolated in the same vein as health risks of smoking or obesity or drinking too much alcohol. And it may have just as much in terms of magnitude of risk and association as those things.
And we're talking mental and physical problems here, because I think loneliness and isolation, I think people can understand the mental difficulties, but there are physical, I mean, goodness gracious, the risk as far as dementia and these sorts of things, stroke.
Yeah, I think, there's a healing power to being around people, about enjoying and having a meaning in life. A reason to get up in the morning, as one of my patients put it. And our connection to others really provides that, including health benefits. If you're connected to somebody, you get out of bed, you get out of the house, you start walking. There's a lot of health risks that aren't too far-fetched to understand of how this could actually have impacts on physical health.
Well, help us define loneliness and isolation.
Yeah, so there are two separate constructs here. So I always like to tell patients who come to me that if you're alone, you're not alone in feeling alone. It's very common. So about 40% of older individuals will feel loneliness. So you can be surrounded by people and feel lonely if you're not connecting, et cetera. So loneliness speaks a lot to the quality of our social interactions. But then there are some people who are just like to be alone. They could be socially isolated, but not feel lonely at all. And about 25% of people feel that way. So they both have different health benefits. Like we just heard about folks experiencing flooding or
Yes.
Huge snowfalls.
Yes.
If you are experiencing that, do you have someone to call on? So you could be socially isolated and have health risks. And you could be surrounded by people and socially connected online, but feel very lonely.
Yeah. A recent study, more than a third aged 45 plus feel lonely. Nearly a quarter, 65 plus, feel isolated. And again, the reasons: living alone, loss of family. The older you get, the loss of friends. It all adds up, doesn't it?
It does. And you have to reinvent yourself. We're used to doing that when we're younger. You go away to college or to a new school or a new job. We learn to make new friends. But unfortunately, a lot of times as people get older, they start thinking, oh, I'm older, what's the point? And I'm a geriatrician, so when people think that they're older, I think of them as young.
Yeah, average age as far as you're concerned. But if there's a 50% increase in dementia, 29% increase in heart disease, 35% increase in stroke, what's going on with the body here? What's happening?
It's probably the impacts of chronic stressors. Also, maybe it's simple things like getting to the doctor's office. You can't drive anymore. Is someone taking you to get your blood pressure checked, to get your cholesterol checked? It's probably complicated. These are correlational sort of risks, but definitely those are some of the things that are hypothesized. Access to care, along with the impacts of the chronic stress of feeling lonely.
Is this something that has always been here, and we now have studies to tell us it's around?
Yeah, I think so. When you look culturally across the globe, societies that have social connectedness as a big part of their fabric, where older individuals have a role in families and extended families in the social structure, they also tend to be some of the societies that are the longest lived, no surprise. So we've known about this and the importance of this for a very long time, but as we in the United States have much more of a nuclear family, it's just me and myself, and we value maybe privacy too much for our good health.
Immigrants, LGBTQ, I'm seeing here, even higher risk, huh?
That's right. I have patients who are LGBTQ who may be forced to social isolate themselves or are afraid of moving into assisted living facilities or nursing homes or other places where they may get more connection. Folks who are immigrants similarly may be afraid of moving into congregate living settings like assisted livings or independent living places because it doesn't fit for them.
Right. As far as how to address this issue, healthcare interventions, What's the best way to approach this?
Yeah, so first, talking to your doctor, because sometimes people who are just feeling lonely, they may be depressed or anxious. And we have medications and treatments for those sorts of things. And sometimes we overuse those treatments when we just need to get people connected socially. So it's talking with your doctor is very important to start with. But there are some real simple things that you can do. For example, one of the biggest ways I see that people get socially isolated is hearing. So if you can't hear, you're likely to be surrounded by people but not want to interact or engage because it's overwhelming or you can't understand what's going on. So hearing aids have been shown to be very helpful, including a recent study that showed even mortality benefit from hearing aid users. But that's a very simple thing I address is hearing and telling my patients to get that taken care of and looked at. And then talking to people, encouraging them to reinvent themselves, to go and get involved in social organizations or their church or their religious organization or whatever is meaningful to them, just encouraging them that, hey, it's really good for your health too. It's not just it's nice to have friends kind of a thing.
Yeah. Dr. Amit Shah, Mayo Clinic, Arizona, this is really interesting. And again, there are just some folks who like being alone. You run into those folks too, don't you?
Yeah, but I tell them, if you need a colonoscopy and you need someone to drive you home from it, you still need to make a friend.
Better find a friend out there somewhere. Doctor, thank you so much. We appreciate it.
All right, pleasure. Thank you for having me.